Welcome to this informative video on polycystic ovary syndrome. In today's video we will try to understand what is PCOS and also discuss what problems it causes. What are the common myths involving PCOS? We will understand some facts about this condition, learn some lifestyle changes that can help you deal with PCOS. Also learn how women facing fertility issues due to PCOS can be helped. Polycystic ovary syndrome or PCOS is a common hormonal problem in women. In this condition, women have higher levels of male hormones called as androgens. This hormonal imbalance can cause acne, unwanted facial hair with male pattern, excessive pigmentation on some areas of body like neck. But the most common symptom that causes women to recognize PCOS is either irregular menstrual periods or completely absent menstrual periods for a few months. Sometimes fluid-filled pouches or cysts may be seen in the ovaries on performing an ultrasound scan. Common myths about PCOS that we are going to debunk in our video. Myth 1. PCOS is a very rare condition. Only a very few women are affected by it. Fact: it is a pretty common occurrence among women of reproductive age group. About 10% of all women are affected by PCOS. Myth number 2. PCOS only occurs in obese women. Fact: though it is observed that most women with PCOS happen to be obese, it can also occur in thin-built women. Myth number 3. If you have irregular periods, you have PCOS. Fact: irregular periods can occur because of many hormonal, gynecological conditions and causes like stress. Myth number 4. Losing weight will cure your PCOS. Fact: most women dealing with PCOS also have to deal with obesity and its consequences like diabetes. Losing weight will not just help in decreasing their symptoms but will also help in decreasing their future risk of developing other metabolic diseases. Myth number 5. You can't get pregnant if you have PCOS. Fact: even though getting pregnant might be a little more difficult for women with PCOS, but they can achieve pregnancy both naturally or with some medication or procedures to help the process. Lifestyle modifications. 1. Exercise regularly. Regular exercise has many benefits in treating PCOS. It helps you combat obesity. Exercise can also help lower levels of cholesterol and male hormones too. Manage weight. Maintaining a healthy weight will help in decreasing symptoms of PCOS. 3. Watch your dietary intake. It's helpful to limit the amount of carbohydrates you consume. Increase intake of dietary fiber. Avoid refined carbs, which are found in processed foods, especially white flour, rice, potatoes, and sugar. You should also avoid sugary drinks, including soda and juice. Tips to achieve pregnancy in women trying to conceive while dealing with PCOS. 1. Adopting a healthy lifestyle including being in the healthy weight range, not smoking, cutting back on alcohol, eating a healthy diet, getting plenty of regular exercise and enough sleep, is the first thing to do to improve a woman's chances of becoming pregnant and having a healthy baby. 2. Weight loss. For women with PCOS who are overweight or obese, a modest weight loss sometimes results in more regular ovulation, which increases the chance of pregnancy. 3. Fertile window. For those who know they ovulate, having sex during the fertile window, 5 days leading up to and including ovulation, boosts the chance of conception. 4. Medication. If you have very irregular or only sporadic periods, this is an indication you are not ovulating and need ovulation induction. This involves a course of tablets or injections to stimulate the ovaries to release an egg that can be fertilized, either during intercourse or through intra-uterine insemination IUI. 5. IVF. This doesn't work. IVF may be needed a course of injections to stimulate the ovaries to produce multiple eggs. When they're mature, the eggs are retrieved and sperm are added to the eggs in the laboratory for embryos to form. A few days later, an embryo is placed in the uterus where it may implant and grow into a baby.